Hello all, I'm Dr. Divya Jose. I'm Senior Consultant Gynecologist at Lourdes Hospital and Divine Rose Women's Clinic, Kochi. I know how anxious you can get if you get some sickness in pregnancy. The anxiety level just goes sky high when you get COVID in pregnancy. In this second wave of COVID, I have a lot of patients, pregnant patients, who have become COVID positive. They ask me a lot of questions, or there are a lot of concerns when they get COVID positivity in pregnancy. So I thought I'll do a video about the frequently asked questions when you get COVID positive in pregnancy. So the first question you will ask is, will it affect my baby? The chance of transmitting this virus or spreading this virus from the mother to the unborn baby through the placenta is very rare. The chance of getting an abortion or premature delivery or growth problems due to COVID, usually which are mild, is very less chance. Only if the mother becomes very sick, mother's condition becomes very serious, her oxygen level falls quite bad, then it can affect the baby very badly. So is there a chance that when you get pregnant and become COVID positive, the COVID complications are quite high when compared to people who are not pregnant? There's nothing like that. Even in pregnancy, when you get COVID, just like other people, most often you will have mild symptoms like fever or loose motion or cough, sore throat, tiredness, and all these mild symptoms, which usually recovers within a few days, within 3 to 5 days. But those who are in the high risk category, that is like people who are more advanced age when they're pregnant or when they have additional complications like diabetes or uncontrolled, especially kidney problems, asthma, heart problem, etc., they have a high risk of having complications of COVID in pregnancy. So those who are having mild symptoms can be managed with home quarantine. Those who are in the high risk group, it's always better to get admitted to at least the second line treatment centers. Now, what happens in home quarantine? What are the things you should be doing? So, you should be having a well balanced diet, which is easily digestible. You should not confine yourself to a bed unless you have been advised a bed rest by a doctor. It's not advisable to have a complete bed rest. You should be moving around. You should have some level of activity happening, yoga, breathing exercises, and all those should be happening. And to bring down your level of stress, you should always pursue some hobbies. You're reading, painting, drawing, and always have a good communication with your family members over video. Continue all your routine medicines, iron, calcium, and all those routine medicines you've been taking, you can continue. Now, what are the symptoms or what are the things which alert you and tell you that now home quarantine is no longer safe for you? You have to seek hospital care. So, what are the symptoms which alert you to that? So if you have persistent fever, if your fever is not coming down after a few days, if you have cough, you're not able to lie down, or if you're feeling breathlessness or short of breath, or the 6-minute walk test. So what is a 6-minute walk test? 6-minute walk test is you walk around in your room and you check your oxygen level with the pulse oximeter before and after walking. So if there is a fall in the oxygen saturation by 3 points, like it was in the normal range, like somewhere around 95 before, but after you walk, it has fallen down to below 92, that is a 3-point fall, then it says that, okay, this is not something which is quite okay. Or if your oxygen level at first instance is itself less than 94%, then also it says that your oxygen level is not adequate, you need to seek hospital care. Now, about the medicines. So, everybody is concerned to take medicines in pregnancy, whether it's safe for your baby, whether it's safe to continue all those medications. Definitely, that question will arise. So, the routine medicines like for fever, what you take is paracetamol, cough syrups, multivitamins, all these are quite safe in pregnancy. Now, when you require antibiotics or antivirals, the doctor will prescribe you the safest medicines which can be taken in pregnancy. Some people may require steroids, either by using as an inhaler or by oral medications or injections. For a short period of time, they are not going to cause any major problems in pregnancy. Sometimes, especially those having sugars or diabetes, can have some fluctuation in their sugar levels. which usually comes down with when you stop the steroids. Only if the disease worsens, and then we may have to step up the medications, which may not be quite safe in pregnancy. Now, what happens if you get COVID positive and your checkup is due? You are due to see your doctor. So we know that we're not supposed to roam around or go outside when we are having COVID. So most of the hospitals have this telemedicine consultation. They can call up the doctor, speak to the doctor, tell them that you're pregnant, that you're COVID positive, and your checkup is due. So ask him or her whether it is safe to postpone your checkup. And what about whether you need to continue the same medications which you have been taking, and you can also clarify your doubts regarding the medicines given for COVID also. But without a doctor's advice, it is not at all safe to postpone your checkups. So please contact the doctor who will be having all your medical details and who can assess and say that it's safe or not safe to postpone your visit. So if you need to see the doctor when you are in home quarantine, or if you develop some problems in when you're having home quarantine, you develop some problems related to pregnancy like reduced movements or bleeding or leaking, then what should you do? So most hospitals have this COVID OPs or fever clinics where they will be seeing patients who are COVID positive. So we know that it is not safe to mingle with patients who are not COVID positive. We don't want to spread the infection. So if you have any health concern, you can consult the doctor in the fever clinic. Sometimes the doctor whom you have been seeing can also come and see you in the fever clinic and not in your routine OP. Now, the next concern is whether it is safe to take an X-ray in pregnancy. Sometimes when the doctor suspects that there is pneumonia or some worsening of your cough and they want to just see how your lungs are, then they may advise an X-ray. And we know that X-ray, and most often we have heard that X-ray is not safe in pregnancy or X-ray should not be done in pregnancy. But an X-ray, if required, can be done in pregnancy, and to reduce the amount of radiation that goes to the baby, we can ask for a shielding with a lead apron over the tummy. So when you do that, the amount of radiation which goes to the baby is very negligible, and it's almost very safe to take an X-ray if required in pregnancy. Now then, another concern arises is when you're COVID positive and your due date is near. We know that we cannot go beyond our due date and wait till the COVID settles. So you contact your doctor, speak to them and tell them that you're COVID positive. And if they are having a facility to take a COVID delivery, it can be planned there. Or they will refer you to a place where a COVID positive delivery can be conducted. So where you will have isolation rooms, the healthcare workers will be using PPEs to see you. There is no indication or there's no reason to do a cesarean section only because you're COVID positive. So there is always, you can try for vaginal delivery only if the mother is in a very bad condition, she cannot go through the stress of labor, then only you may have to do a cesarean section just because of COVID. Now you've delivered. Now the next concern is whether it's safe to breastfeed. There is no transmission of virus through the breast milk. So breastfeeding is absolutely safe for the baby, and we know it's the best food for the baby. So what are the things we should be careful to prevent a transmission of infection to the baby, because you'll be in the same room. So always use mask. Before taking the baby, sanitize your hands and never lift off your mask when you're breastfeeding, because baby is very close to you, and let the baby sleep a little bit far away from you when the baby is sleeping. To reduce the risk further, if you have a responsible person to take care of your baby, you can ask them, you can express breast milk and ask them to feed your baby till you have recovered from COVID positivity. Now, a lot of people ask about home remedies like steam, whether to take steam, whether to take turmeric water and all those things. See, in moderation, it is okay. There's no problem in taking steam inhalation in pregnancy or turmeric water and all those things. In moderation, it is okay. But they are not proven to prevent COVID. The only proven defense we have against COVID is SMS, that is sanitization, social distancing, and use of masks. So it's very important that even if most people get very mild COVID infections, we cannot say, or it's difficult to predict who will get it badly. So it's always better that we follow all the precautions and practice SMS very honestly and stay safe. Thank you.